Okay, our entry point is Sanjiao 1, exit point Sanjiao 22. Our Luo connecting point Sanjiao 5, and there is a connection between the Luo channel on the Sanjiao and the pericardium channel in the center of the chest. Our Shi cleft point Sanjiao 7, Yuan source point Sanjiao 4, front mu point Ren 5, back shu point is urinary bladder 22. Our Jingwell point Sanjiao 1 associated with metal, Ying spring point Sanjiao 2 associated with water, Shu stream point Sanjiao 3 associated with wood, Jing river Sanjiao 6 associated with fire, and our Hesi Sanjiao 10 associated with earth. Our exit branch is Sanjiao 22 to gallbladder 1 on the face. Okay. Sanjiao 1, Guan Chao, great hub. This is our Jingwell point, metal point. On the lateral side of the rim finger, point 1 sun proximal to the corner of the nail. Clears heat, expels wind, invigorates blood, restores consciousness, and stops convulsions. Headache, redness of the eyes, sore throat, stiff tongue, febrile disease, and irritability. Sanjiao 3, Zhongzhu, central eyelet. This is the shu stream point, the wood point, tonification point. When the fist is clenched, the point is on the dorsum of the hand between the 4th and 5th metacarpals, in a depression proximal to the metacarpal phalangeal joint. So make a fist, come off the metacarpal phalangeal joint on the ulnar side, right between the 4th and 5th metacarpals, and you'll come to a depression. That is Sanjiao 3. Actions: clears heat, expels wind, benefits the ears. See, that's bolded, so that's a big function of this point. Lifts the mind, cases of depression. Right? Often we see like liver qi stagnation leading to depression. And so this is a case where we have a connection between the Sanjiao channel and, leg, arm and leg Shaoyang, right, in the liver channel. So it lifts depression, lifts the mind, removes obstruction from the channel, and regulates qi. Indications: headache, redness of the eyes, deafness, bolded. This point is great for the ears regardless of the pathology. And it's a good point to use after clearing the ear, to clear the ear after flying. So when you get that sensation of the fullness in the head when flying, this is a great point to use. Tinnitus, sore throat, febrile disease, pain in the elbow, arm, and fingers. Right? The name central eyelet may refer to the original qi, and that it flows through the Sanjiao. Eyelet refers to water metabolism and an island's ability to direct flow, right? Because the Sanjiao is the place where water moves through the body. This is the sluices and waterways of the body. And Yuan Qi flows through, right, the center, through the Sanjiao. So just something to think about. A little bit deeper look. Sanjiao 4, Yang Qi, Yang Pond. This is our Yuan source point. On the transverse wrist crease in the dorsum of the wrist, in the depression lateral to the tendon of extensor digitorum communis and extensor digiti minimi. Okay, many people, when they locate this point, come a little too medial. It really is. If you continue the line between the 4th and 5th metacarpals, wiggle the pinky, flex the wrist, flex the fingers, and wiggle the pinky, you'll feel those tendons. And right between those two tendons at the wrist crease. Yongji, Sanjiao 4. Action: relaxes the sinews, remove obstructions from the channel, clears heat, regulates the stomach, promotes fluid transformation, benefits original qi. Right, it is the Yuan source point, but in a way it's the Yuan source point of Yuan source points, right? Because the Yuan qi uses the Sanjiao as a conduit. Tonifies the penetrating and directing vessels. Indicated for pain in the arm, shoulder, and wrist, malaria, deafness, and thirst. Sanjiao 5, Weiguan, outer pass. If you remember, pericardium 6 was Neiguan. Inner pass, Sanjiao 5 is outer pass. The Wu connecting point, master point of the yang linking vessel. Just as pericardium 6, Neiguan was the master point of the yin linking vessel, the yin wei mai. Sanjiao 5 is the master point of the yang wei mai. 2 sun proximal to the transverse wrist crease, on the line connecting Sanjiao 4 and the tip of the olecranon. The point lies between the radius and the ulna. This is directly opposite pericardium 6. Right there, they can be connected. Indicated in cases of febrile disease. Right? High fever, all headaches, night sweats. Headache, HA, pain in the cheek. Right? With gallbladder 41 if somebody has like lateral pain, pain on the side of the body. Good point for the strained neck, deafness, tinnitus, pain in the hypochondriac region. It's also good for menstrual cramping and local pain in the fingers, hand, arm, and tremors. It expels wind heat. There's your febrile diseases. Releases the exterior, right? Headaches can be caused by exterior wind. Subdues liver yang, removes obstructions from the channel, and benefits the ear. Can be used with pericardium 6 for chest pain. Sanjiao 6, Zhigu, branching ditch. This is our Jing River point, our fire point, and it's a Harari point, right? Fire on the fire channel. 3 sun proximal to the dorsal wrist crease, so 1 sun above Sanjiao 5. On the line connecting Sanjiao 4 and the tip of the olecranon, between the radius and the ulna on the radial side of extensor digitorum. Okay, because on the ulnar side of extensor digitorum will be Sanjiao 7. So on the radial side of extensor digitorum. Regulates the qi, removes obstruction from the channel, removes obstruction from the large intestine, clears heat, and expels wind. So it's a good point for constipation. Particularly constipation caused by dryness or heat. Indications: tinnitus, deafness, pain in the hypochondriac region, vomiting, constipation. Febrile diseases, constipation. Aching and heavy sensation of the shoulder and back, constipation. Sudden hoarseness of voice, and constipation. A very good point for constipation. And vomiting, and the same thing with Sanjiao 5. Right? Okay. Sanjiao 10, Tiangjing, celestial well. This is the Husi point, our sedation point, or earth point on the fire channel. When the elbow is flexed, the point is in the depression 1 sun superior to the olecranon. relaxes the tendons, resolves damp and phlegm, dispels masses, clears heat, dispels stagnation, regulates yin and wei, nutritive yin and wei, defensive qi. Indications: migraine, headache, pain in the neck, shoulder, and arm, epilepsy, scrofula, and goiter. Sanjiao 14, on the shoulder, posterior to large intestine 15. In the depression inferior and posterior to the acromion when the arm is adducted. Dispels wind and overcomes damp, moves qi, quickens the blood, and alleviates pain. It is used for shoulder pain and frozen shoulder, motor impairment of the upper arm. Okay, so if you find large intestine 15, if you abduct the arm, yep, then you find large intestine 15, and just opposite, posterior to large intestine 15, you should find, it's almost like the eyes of the shoulder, you know, the eyes of the knee. Large intestine 15 and Sanjiao 14 kind of make up the eyes of the shoulder and help deal with shoulder problems. Sanjiao 17, Yifeng, windscreen, behind the earlobe in the depression between the mandible and the mastoid process. Expels wind and benefits the ears. This is another point that I use very effectively for, clearing clogged ears, draining the ears, and stagnation in the neck. But really, really good point for the ears. So tinnitus, deafness, otorrhea, facial paralysis, toothache, swelling of the cheek, scrofula, swelling of the neck, and trismus, like lockjaw. Sanjiao 21, ermen, ear door, in the depression anterior to the supratracheal notch and slightly superior to the condyloid process of the mandible. The point is located with the mouth open, right? So, Sanjiao 21 on top, small intestine 19, and gallbladder 2 at the bottom of that space in that depression when the mouth is open. Courses the channels and quickens the connecting vessels, opens the portals and boosts the hearing. Indications: tinnitus, deafness, otorrhea, toothache, and stiffness of the wrist. Interesting. But we know the channel's connected, and often we can use one end of the channel to treat the other end of the channel. And Sanjiao 23, silk bamboo hole in the depression on the lateral end of the eyebrow. Expels wind and brightens the eyes, stops pain. So indicated for headache, redness and pain of the eyes, blurring of vision, twitching of the eyelid, there's wind, toothache, and facial paralysis. Okay, sukong, silk bone bamboo hole. Right. We have UB2, which is bamboo gathering, which is the medial end of the eyebrow, and now we have silk bamboo hole, which is the depression on the lateral end of the eyebrow, which is Sanjiao 23. Think of Sanjiao points for ear difficulty, eye difficulty, and clearing heat, particularly heat from an exogenous pathogen.